Let me introduce you to Shelby, Shelby Bar. Shelby is one of our senior citizens. She's 14, just over 14, and her mother loves her dearly. And recently we investigated her because she wasn't doing very well, and she was urinating a lot, drinking a lot, just not quite the right thing, and we diagnosed her with Cushing's disease. That took quite a lot of workup and investigation, and now she's on medication, which she'll be on for the rest of her life, and she's doing wonderfully well. But Shelby, like a lot of dogs, has dental disease, and typically on a yearly basis we need to clean her teeth because they are just so bad, in spite of everything that her mother does to keep them clean. Now, just on a side note before I come back to Shelby, there was a study released just on 6 weeks ago in which they did a long-term study on what are the primary drivers to longevity in pets. And the two primary drivers are obesity and dental disease. And dogs and cats that had their teeth cleaned once a year when it was needed outlived by a long way pets that didn't have their teeth cleaned when needed. So ensure that you check your dogs and cats' teeth if they need doing, or you think, or you're not sure. Bring them in. We're happy to do a free dental check for you. It doesn't cost anything. Just ring up and book it, and we can tell you whether your pet's teeth need doing. We heavily subsidise early dental disease in pets, and we charge about half of what we should be charging. We try to make it super affordable for people. Anyway, sidetrack. So Shelby's mother has invested a lot of time, effort, and her hard-earned savings, because she's an elderly lady, in Shelby's care over the last few years. And when it came to having Shelby's teeth done, she just couldn't see a way to come around to getting it done. So Shelby's here today on us. We're running a senior blood screen like we do on all older guys and gals before surgery. She's going on an IV drip, and then we're cleaning her teeth. It is a clean. There'll be no extractions needed. Her teeth aren't that bad. As I said, her mother looks after her really well. And so I just thought we'd share Shelby's story and with you. And when we go to surgery and we're cleaning her teeth, when Leanne's doing her teeth, we'll show you some of what happened. Hi again. Here we are with Shelby. She's under anaesthetic. As with all our patients, she's on a heat mat. The biggest source of anaesthetic complications is drop in body temperature. She's on a heat mat. She's on a drip. Just come over here and have a look at her teeth. And you can see they're horrendous. You can see how red the gums are. There's pus there. Let me just scrape that off. You can see that flicking off like that. There's the normal tooth under there. And have a look at all the teeth. They're all really scuzzy. Now, she was done 12 months ago. And as with all our, as with all the patients on whom we do a dental procedure, we sat down with her mother a week after they come back, and we check everything. And then we also sit down and map out a home care plan. We do that without compliments. There's no charge on that. It's all part of what we do. Cleaning the teeth is really easy. But if we always do what we've always done type of thing, you're always going to get the same result. So typically bad teeth are due to a mixture of poor quality saliva. Some dogs just have poor quality saliva. And then what they're fed and what they eat. Dogs don't eat what they ate a million years ago, nor do cats. And the recent studies show that, quote unquote, the only way they clean their teeth is by ripping meat off the bone. There's not many dogs going to do that in your house or in your backyard, certainly not in mine. And since they're not doing that, that mechanical action of cleaning is no longer done. We've bred them for long ears, short legs, pink hair, blue eyes, green hips, whatever we've bred them for over the last 1,000 years, because we think that looks pretty. And in doing so, we've inadvertently selected for crappy quality saliva, poor quality saliva. there's so many studies now that show that saliva quality is the prime driver of dental disease. So we can't fix the quality of the saliva, but we can certainly get them eating diets that are more helpful in cleaning their teeth. So cleaning the teeth is step one, but as I said a minute ago, if we always do what we've always done, we're always going to get bad teeth. So we map out a home care plan with the owners of dogs like Shelby to alter or adjust their diet and do all sorts of different, there's a dozen different options that we go through, things that they can do at home to improve the teeth cleaning action of the treats they give, of the food they give, etc., etc. And that really delays the onset of periodontal disease. In Shelby, it's worked for 9 to 10 months, and now 12 months. The teeth have crashed, if you want to put it that way, and so we do need to clean them. And it's a very simple process. It's very safe. It's very quick. And as I said, we do it extremely inexpensively for these guys that need to come back, so that we can give them the best opportunity for long health and a great quality of life. When we actually get to scaling, in a couple of minutes' time, we'll turn the video on and you can see exactly what happens. The cleaning is a two-part procedure. We've referred to this in other videos. The first is an ultrasonic scaler. This is exactly the same instrument that your dentist uses. It vibrates at I don't know how many thousand RPMs per minute and cracks the plaque and cleans it off. Then we use a hand scaler to scale up under the gum, so this will clean the teeth itself, but you can't use this up under the gum, so we do up under the gums manually by hand. And then we use a polishing instrument, this little, and again your dentist does this as well. It's a special paste goes in here, it spins and it cleans the teeth. So as I've said on a previous video, this leaves minuscule pock marks on the teeth, and if you don't polish them out, then plaque adheres to that more easily. And this thing polishes out those pock marks, and you end up with a nice clean surface. So once again, scaling away here, and we'll get a little bit closer in a minute. But if you remember a couple of seconds ago, I flicked some plaque off, and have a look at it. This is how thick it is. It's probably 1.5 millimeters thick, and that's came off that carnassial tooth. So yeah, have a look at your pet's tooth. I hope you don't see anything like that. And it's also very important when we're doing dentistry like that, the table is angled down so the water runs out. If the table is flat or level or going the other way, then water could run down the esophagus, which doesn't matter, or worse, down the larynx or down the trachea, and we'd end up with a puppy dog that had a nice clean teeth but then had pneumonia on top of that, and there's not much point in fixing one problem and getting a second problem. So that's about it. So we'll come back when Leanne is polishing, and you can see how that works. So Leanne's just finished stage 1, which is the scaling, and it's taken her just on an hour to scale this guy's teeth. They were that bad, in spite of being done 12 months ago. So she is just a plaque magnet, okay, and that's just the way it is. Now what Leanne is doing now is polishing. Now this is a special polishing paste. If you've ever had your teeth cleaned at your dentist, your human dentist, then this is exactly the same. We use the same paste, we use the same polishing cups, it's exactly the same procedure. And as I said earlier, this polishes the pits out of the teeth and leaves a nice shiny surface, and plaque finds it really hard to adhere to that surface. So this won't take that long, and that's the end of Shelby's dental procedure. She'll go home this afternoon. We'll sit down with her mother again next week and plan out our 12 months maintenance program. As I said, there's absolutely no charge on that when we do that with a client. and hopefully we'll be able to slow the disease process down even more. So I hope this has been of some interest to you. I'll see you on the next video.